Hi, I'm Dr. White. I'm one of the neonatologists here in the NICU at Cook Children's. There's a lot of things to think about when we talk about safe sleep. We do use weighted items in the NICU. They have a little bit of weight with just a little bit of beads in it, and they're used to help the baby's muscles and their joints and everything get stronger, and they're used by professionals who know where to position them so that it's not causing damage or hurting anything. Once they go home, weighted blankets are not recommended by the AAP, and we do not recommend them either. It hinders the natural response of a baby to wake up for whatever reason they need to. Those cushions, the pillows, the stuffed animals that make the bed so cute are things that can hinder a baby from waking up and breathing normally. We try really hard in the NICU to only have a few things extra, like stuffed animals and loveys, to help with the baby connecting with mom and the mom connecting with baby when they have to be separated. And that's where that lovey is, and that's a set thing. Baby's going home with mom. They should be sleeping in mom's room and know that she's there. At-home monitors that are commercially purchased, the AAP says they do not support because it lulls parents into a false sense of security, but also may not actually decrease the risk of SIDS. But they do recommend baby sleeping in the parent's room for at least the first 6 months. The baby should be in their own safe sleep crib, bassinet, playpen, not their bed, but the family can respond to baby's waking cycle noises appropriately instead of relying on a commercially purchased at-home monitor as the way to know if baby is okay. I do not recommend blankets, nor does the American Academy of Pediatrics recommend blankets as the way of swaddling a baby. We use it for tummy time so that they're laying on something clean or to cover them while you're holding them. But when they're sleeping, they should be in a sleep sack. We recommend swaddling, usually term babies up until about 8 weeks of life. And that's when they start to roll. And if they start to roll a little bit sooner, you would want to get them out of the swaddler so that they can safely move back and forth with their arms. And that's when they make sleep sacks, but without any of the swaddle component of it, which would be your safe way to make sure that the baby has a blanket on, but that blanket can't get up over their head and be a risk for suffocation. Our preemies love to be on their bellies. I think part of it is a developmental thing, and some of it has to do with how much respiratory support they need sometimes, and they get a whole bunch of air in their belly, and they just breathe a lot more comfortably on their belly, and it's a safe spot for them. As they move to term, we will start leaving them on their backs primarily because that's the safe thing for sleep. The recommendation is to start a few minutes a day and build up that tummy time while the baby is awake. As babies get better, parents come to see their nurses and the staff here and this place as a home away from home. And it's really hard to leave it for some families. We're all here to help and help support them, and we just want our kids to do well and thrive when they go home. For more information, please visit safebabysleep.org.